Hello everyone, this is me, Saankhya. Welcome to TALRadio, where we shine a spotlight on organizations and individuals that make a remarkable difference in the world. So today we'll be delving into the critical issue of equitable access to cancer care and the remarkable efforts being made to bridge the gaps that many patients face. Enter the Lazarex Cancer Foundation, a beacon of hope in the fight against cancer disparities. Founded in 2006, Lazarec is dedicated to improve cancer health outcomes by providing assistance to patients seeking access to clinical trials and cutting-edge treatments. The mission centers on creating cancer health equity by increasing access to quality care and clinical trials for all communities. And over the years, they've developed programs that offer financial assistance, navigation services, and community engagement to support patients throughout the cancer journey. So to help us explore more of the foundation, today we have guests right here. So joining us today are two extraordinary women who play pivotal roles in this organization. So first off, we have Erin Miller, the Director of Administration and Development at Lazarex Cancer Foundation, along with a very personal story behind her operation to work hard. Dedication and passion have been instrumental in developing programs that provide equal access to cancer resources. So also with us is Dr. Marya Shegog, Director of Programs at Lazarex. So Dr. Shegog brings decades of experience in cultivating health equity in diverse communities. Her commitment to action, education, and research has been a driving force in diversifying the narrative of cancer care. So without further ado, let's get to welcome these wonderful guests today. Erin and Dr. Shegog, welcome to the show. It's an honor to have you both here.
Hi, thank you so much. We are honored to be here.
Yes, thank you.
Thank you. So let's jump right into the questions. So my first question would be for Erin. Can you share the story of how your personal experience with your husband's cancer journey influenced your work at Lazarex Cancer Foundation?
Sure. So Mike was diagnosed with stage 4 pancreatic cancer back a long time ago, back in 2003. And he was basically had metastatic cancer in his lungs and in his liver at the time that he was diagnosed. So we knew right away that we needed to find a clinical trial in order to have hope that he could, possibly survive the pancreatic cancer. So we started looking into clinical trials on clinicaltrials.gov, and it became incredibly overwhelming. We were 2 hours away from the cancer center, and we were starting on chemo in the meantime, just trying to buy some time while we were looking for trials. And so I asked my sister Dana if she would help us find a trial, and she dove right in, and it took her working full time, like 5 weeks, to find us to find our trial options, because it was so difficult at that time to even get that work done. So she did find us a trial. It was a gene therapy trial. Mike was a geneticist, so it was what he really wanted. And he was accepted into that trial. And then we realized that we were going to deplete all of our savings. And we had 3 young kids at the time and a brand new house. It was just like, Mike said, no, there's no way I'm going to, leave you guys in such a vulnerable position if the trial doesn't work. So my family gathered together and said, nope, you're going to go. You and Mike are going to go and do this trial. And they were willing to help us with the finances to get back and forth. And they tag teamed our kids while we were away for 3 weeks at a time. So it was a lot, but we were able to go. And Mike actually survived 19 months. And so my kids remember, my youngest remembers him because of those 19 months, and he felt good during the trial. We were able to, go on some trips, a ski trip, and just make some really great memories. But there were some things during that period that we found so difficult. And one of them was to find the trial. And then the second realization was how much it was going to cost to get back and forth. And, we had this great buildup of hope, and then suddenly it was like, no, we won't be able to do this. And then my family rallied around, and not for 1 second did it really fall flat that I was just lucky that I had a family that had the resources and the willingness to be able to support us during this journey. And, so many people, most other people out there don't have that kind of support system. And it was the hardest thing by far that I've ever been through. And I would say the same for Mike, but he's not here to tell the tale. So I just, from that point on, kept saying, like, what are we going to do about this? Somebody needs to do something about this. And my sister Dana jumped in and founded Lazarex Cancer Foundation to fill the gaps on all the things that we found were difficult during that time. So Lazarex was created in 2006 to do clinical trial navigation to help people find their options. And then we fundraised to reimburse them the out-of-pocket expenses so they could get to their clinical trials for themselves and for a caregiver, because nobody needs to, wants to, or can be alone at that time during their life when they're going through such a difficult and traumatic event. So that is truly how Lazarex started.
Great. Thanks a lot, Erin, for opening up such a vulnerable side of the story. So my next question would be for Shegog. So, hi, Shegog.
Hello.
Hi. So, tell us what inspired you to focus your career on health equity, and how did that path lead you to Lazarex Cancer Foundation?
Growing up as an African American woman in the Midwest, I not only heard so many stories from my family where health inequities ended or severely limited the lives of family members, but I also watched many people in my family who work in the healthcare field try to address it in their own way. And I am one of those people that Erin spoke of that had no one to advocate when I had cancer. And it's really tough to have a disease that might kill you and have to try to make decisions when you're not really even sure if your brain is working completely correct. So advocating for people to have access to the care, the support, the care, and the information they need so they can make what is ultimately going to be a life-altering decision is really important. And it's definitely an area of healthcare where we see a lot of inequities that I believe we can address effectively.
Great. So my next question is for Erin. So Erin, can you walk us through the process of developing programs at Lazarex and the factors that you particularly prioritize to ensure that they meet the patient's needs?
Yeah, so as I mentioned in the last question, we were founded in 2006. Our original program was called Lazarex Care, and the purpose of it was clinical trial navigation for patients and then helping them get to their clinical trial so they could have, hope and a chance at life. And then in 2013, Dana started really looking, our founder started really looking at what we could do to make sustainable change. And our impact program was born, improving patient access to cancer clinical trials. And the purpose of that program was to prove to industry, to pharmaceutical companies and biopharma companies, that by investing a small amount of money up front and doing some very simple things, we could change the landscape of clinical trial, both recruitment, we could enroll more patients in trials and have a greater diversity in clinical trials. And so Impact was born. We did our first pilot program at Mass General Hospital, back when it was Mass General Hospital, in Boston from 2013 to 2016. And by offering reimbursement to every patient that was considering being in a trial, we were able to improve their enrollment by 29% and basically double their minority or diverse participation in clinical trials. And so we we rolled Impact out at several sites, about 6 or so. And we're able to conveniently, and as we had knew was going to happen, we were able to prove that by offering the program to everyone, by offering the reimbursement to everyone before they made their decision, that we would see the increase in enrollment and diversity. And we did. In fact, we did the program together at USC Norris in Los Angeles and here at UCSF in the San Francisco Bay Area. And we're able to see a 63% minority participation in those across those patients, with 52% of them coming from households earning $25,000 or less. So clearly we were able to help patients that would have had a really difficult time affording to participate in those trials on their own. And what we learned from both CARE and from Impact is that in order to really be able to help patients in the most significant way, that we needed to start earlier and in the community and across the continuum of cancer care, from prevention all the way through survivorship, including care and clinical trials and all those things. But this is really Dr. Shegog's area of expertise, because she manages all of our cancer wellness hubs, which is our newest program, although it's been around since 2017. But I would like for Marya to talk about that, because she is really the expert in the hub area.
Sure. One of the things that that Lazarex did, which was we believe in making sure that there's evidence for our actions. So we do evidence-based. So Lazarex partnered with Drexel University School of Nursing and School of Public Health, and they did a pretty deep dive into the state of cancer in Philadelphia. And what they found was that the social determinants of health drive how you get health care and how you get cancer care, and also what you get offered. And so part of the solution we found at Lazarex Cancer Foundation was to create the Lazarex Cancer Wellness Hubs, which are really, they're not brick and mortar usually, they are pop-ups. And so we go into communities that are underserved and usually have, health, that have really low healthcare access. And we go into these communities and we are there, both to be a teacher and a student of the community. So community members come and they have the opportunity to ask their questions, and if they need resources such as getting connected with maybe a primary health care provider or a medical home, or if they need screening, but also if they just have questions about a loved one who has a cancer and maybe what is their risk, or if they need some psychosocial mental health support. What we do is by being present in the communities, we are there to answer questions and support people in their cancer journey by defining our lifetime as a cancer journey, meaning that everyone is either touched by cancer themselves individually, a family member, or has done a lot to prevent it. All of those things mean that everyone has a cancer journey. And we take that opportunity to interact with community members directly. And we have three Lazarex Cancer Wellness Hub, three regions where the Lazarex Cancer Wellness Hub operates. One is in Los Angeles, one is in Philadelphia, and the third is in the San Francisco East Bay. Each one is a little different, but the outcome is the same, meaning that they work in the communities, reaching out, talking with community members to meet the needs that they have wherever they are.
Great, thank you, Shegog. So this question is for both of you. Can you discuss the importance of diversity in clinical trials and how exactly Lazarex is working to improve minority participation?
Sure. So, medications are created to resolve issues and are tested, sadly, mostly in white people, and not all people are the same. So it's really, really important to create and test medications for the group of people who really needs them. So having diverse participation in clinical trials is incredibly important to learn how, different subsets of people react to medications. And, everybody deserves an opportunity, to survive their cancer. So equitable access, that's my thing, equitable access to clinical trials, that's Lazarex's thing, is so important for people to just have, the best chance at survival, at fighting their cancer. And the latest and greatest medications and treatments are in clinical trials today. So, that's why we feel so passionately about the importance of diverse participation from the medical side and from our perspective, most importantly, from the patient side.
I like to use the analogy of shoes, that one pair of shoes may be comfortable for one person, but it won't be comfortable for every person. And not knowing how a drug performs in multiple populations means that it's not going to be comfortable, or it may not work or be effective. And it's not because, unfortunately, it's the actual body chemistry. So, as Erin said, when you have a population that is at most at risk for a disease and the drug that they're creating is not tested in them, do we know how effective it is in working with inside of that body chemistry? And is it comfortable? Does it work? Is it successful? So diversifying, actually, it means that the drugs and the treatments that are being created can be effective and most effective for the largest part of the population.
Thank you both for answering that. So my next question is for Erin. Erin, how do you approach fundraising and the sustainability of Lazarex programs?
Sure, happy to answer that. So we were fortunate to be able to get FDA guidance language handed down to us in January of 2018 that essentially carved out reimbursement from inducement and coercion. Inducement and coercion handcuffed the pharmaceutical industry for many, many years from being able to reimburse patients for their out-of-pocket costs to be able to participate in clinical trials. So with that FDA language that did the carve-out, we were suddenly in a position to be able to get funding from pharmaceutical companies whom we had many conversations with and who all agreed that if we were able to change the landscape of clinical trial recruitment through policy, that they would ante in. And so we got that language in January 2018, and from that point on, the majority of our grant funding has come from pharmaceutical companies. And so that has been really a gift to us, because really, if you think about it, the person who benefits the most from participating in a trial, hopefully, is the patient. But secondarily is the pharmaceutical company, because they need patients to participate in trials in order to get their medications and therapies approved or not. And patients need access to clinical trials for a chance at hope in life. So Lazarex is just kind of conducting the choir between the patients who need trials and the trials who need patients.
Great. So my next question is for Shegog. Shegog, please tell us about a time where Lazarex Cancer Wellness Hubs addressed its biggest challenge, and how did you navigate it?
Wow, that's a really good question. There's so many cases where there is an apparent bias in care provided for patients. So we had one incident where there was a woman who was experiencing breast cancer, and it was metastatic, and she was, managing it the best that she could. But she also, in her culture, she didn't want to be a burden to her family, so her family actually did not know that she was struggling with breast cancer or battling breast cancer. And so she didn't have a lot of support in going to and from the doctor, and ultimately she also didn't have enough money to make all of the ends meet, paying for the medications that she needed and the things to be well, like incontinence. And we were able to kind of support her in both transportation to and from some of her treatments, as well as getting a second opinion for her because she didn't feel as though she was receiving the best care, and also connecting her with an organization so she could get some tools for incontinence so she was a little bit more able to feel comfortable around her family or being out in public or leaving our home, and ultimately allowed her to spend more time doing those things that she loved.
If you both can share a success story that highlights the impact that a report of patients can.
Every story is a success story because it gave individuals the opportunity to learn, make an educated or an informed decision about the things that were going to ultimately impact their life. So I can say in the hubs, I can tell you story after story where the support we had for making sure that a family member of someone who had cancer just was dealing with a lot of stress and fear, and they were able to get into we were able to connect them with one of our peer support partner organizations so they could talk through it, so they could be a better help and support to the person who was actually having cancer. We also have those cases where one time somebody came in and she did not have access to medical care, so we were able to support her in getting connected with getting health insurance, and then she got screened, and in fact she found out, she thought she had a mole on her forehead. It turns out it was actually a skin cancer tag, and so because she was in care and had insurance, she was able to get it removed before it turned into anything more or else. We also do a lot of learning opportunities, and because of COVID, I think there are a lot more hybrid or Zoom than we thought. The cool part about that is that if we're having a learning opportunity in LA, somebody in Philly can attend, or somebody in New York can attend. And so we've also had a great opportunity to kind of talk to many communities and community members about what can be done to prevent it. The hard part is measuring prevention. So if somebody, let's say, stops smoking, do we know that prevented cancer? No, but we know it reduced their risk of getting cancer. So as I say to Erin all the time, I wish everybody came in, it was just prevention. If we could help people understand and make better decisions or different decisions about how they want to live and their life choices, from their diets to even their weight to their physical activity to maybe what they eat, but that's their diet, then it's all a win. So if we have one man of color who starts eating tomatoes every day to help, knowing that that's a preventive behavior for prostate cancer, then that's a win. So likewise, if we have somebody who is in a clinical trial and they've been given 2 weeks to live and they have lived for 6 months, that's a win. I think that it's hard to measure the impact because the very act of living is a win.
Yeah.
Wonderful. Can we also have Erin's views? Yeah, please.
Sure. My favorite thing about what we do is that back when I was going through the cancer journey with my husband, Mike, 20 years ago, there really were very few resources available at that time for cancer patients. And we were really honestly on our own, and we felt like we were fighting this battle kind of on our own. And now the landscape is so different. There are literally thousands of patient advocacy organizations that all exist to provide resources or research or something along the spectrum of cancer for patients. And so we have the distinct opportunity to connect patients with what they need and really be their partner and hold their hand as they go throughout their cancer journey. Because the last thing that you want to do when you're not feeling well and you're so worried and your family's so worried is to try to do all this research on your own and find these things. And so for us to be able to hold someone's hand, walk throughout their cancer journey, help them find what they need to be more comfortable, and hopefully, the end game is more successful, have a more successful cancer journey, have better health outcomes, and to be able to bring communities along during these journeys to help them learn and be more comfortable, and even just talking about cancer. It's a really amazing thing to be able to do that for people. Very heartfelt, and most importantly, good for the patient and for their caregivers and for their families and their communities. And it makes me think of this story of there's a gentleman that we helped whose first name was George. And I don't know, Marya, would you tell George's story, because you tell it so well?
Sure. George is a wonderful human being. He probably about 20 years ago was diagnosed with thyroid cancer and had participated in a clinical trial. He is Filipino, and so he was very aware that this opportunity was unique because he was a minority participating in a clinical trial. That was 20 years ago. Fast forward to the current time, he was diagnosed with prostate cancer, and he had asked his doctors about participating in clinical trials, and his doctors were not as supportive or as did not advocate for him to participate in clinical trials as much as he would like to. And there was some times when the doctors were not where he didn't feel as though the doctors were giving him the complete story of his health or of the status of his cancer. So he came to Lazarex kind of saying, I think there's more that I can do, but I simply don't have the wherewithal or even know where to start to find it. We were able to help him navigate his relationship with his medical care team. We also helped him get a second opinion from a team of docs on his treatment, as well as the outcomes or the impacts of the treatment. Ultimately, we were able to help him get into connect with doctors at UCSF and get into a clinical trial. And even after, and so by the time he got into the clinical trial, his life had already been extended because of the change in care and everything else. But when the clinical trial stopped working, then we were able to help him come to decisions that he was comfortable with as far as his life and what he wanted to do as far as his continued treatment, and also connect him with some mental health supports so that he could, he was getting pretty angry just at his treatment, at the outcome, at the confusion, and he was able to get some mental health support to help him understand and come to a place of kind of peace and joy with where he is and where he is in his life journey. And he's just a great guy, and he was really one of the more informed community members that we had. He knew that there should be he knew that there should be some clinical trials available, and so he had that inkling that he just wasn't getting the information. And we worked together with him so he could get the information, so he could make all the decisions informed. And sometimes it was really just about giving him the questions to ask. There's so many great tools out there to help people who want to track their cancer symptoms. But if you don't know where to find them, or you don't have them at the time where you're talking to the doctor, then they're not really useful. So he was even able to use some of those to help him navigate his cancer journey.
Wonderful, very inspirational. So before we wrap up, I would want one of you to navigate us to how exactly our listeners can contribute to the cause of Lazarex. How can we donate if they want to?
Thank you. Okay. So it's good timing because we're actually in the middle of our end of year campaign. And so you can go right to www.lazarex.org and just hit the donate button. We totally appreciate any and all contributions, however big or small, because that's what it takes to keep our foundation going. So certainly we would appreciate that. And anytime, any place, you are always welcome to go there and read. We have lots of patient stories on the website and some video tools that are really interesting. A video library of clinical trial chronicles and cancer chronicles around different subjects and different stories from patients. So check out the website, and if you feel so inclined, a donation would be appreciated.
Wonderful, wonderful. So that was the end of the interview. So thanks a lot, Erin Miller and Marya Shegog, for sharing your insights and experiences. It was really amazing hosting you guys today. Is there anything that you would want to add before we close the show?
I just was going to say I hope everyone has a beautiful holiday season, and keep in your heart all of the people that are going through difficult times, and hold your families close and enjoy.
And I was going to say that cancer does not have to be a death sentence, and there's opportunities to both prevent as well as treat cancer more successfully. So I encourage anyone who has questions to seek answers, and if they need support in doing that, reach out to us or other organizations until they get the answers that they need so they can make the decisions that are important to them. One of our colleagues says, cancer kills, but it doesn't have to.
So thanks a lot. It's an honor hosting you both today. Really loved your energy and the work that you're doing. It's really inspirational. So that was Erin Miller, Director of Development and Operations, and Dr. Marya Shegog, Health Equity and Programs Director at Lazarex Cancer Foundation. I hope you find this interview insightful. We'll come back with more such inspirational stories, and until then, stay tuned to TALRadio, powered by Touch Your Life Foundation. And this is me, RJ Saankhya, signing off today.